Whether you are suffering in pain from an athletic injury or simply the effects of just getting older, you might be surprised to learn about an option here in Southwest Florida that can help without surgery.
Yeah, that's the key. It's called Prolotherapy. It's creating a lot of buzz in our area. And let us introduce you now to the doctor who is bringing this non-surgical option to Southwest Florida. From Caring Medical Center, I am so happy to welcome to the show this morning. I want to introduce you to Dr. Ross Hauer. He is also a prolotherapist. Good morning.
Thank you, Carly. Thanks for having me.
So excited to be here this morning to tell our viewers about what it is that you guys are doing in this office. And I think a lot of people are going to be interested in what they can learn and find out about prolotherapy. We'll get to that in just a second. But let's talk about knee pain and arthritis, which I understand is extremely common, certainly for people living here in Southwest Florida and as active as we are, right?
Yeah, that's the #1 thing we see in the office here is knee arthritis, knee pain, and that's actually one of the reasons that athletes can't run, they can't play golf, they can't play tennis. So
I think sometimes people assume that, maybe when they start to have some knee pain that, oh no, I'm going to have a knee replacement surgery. Is that always the case?
most of the time it's not the case, actually, Carly. What we do is actually a regenerative injection technique called prolotherapy. Specifically, what we're doing is stimulating the body to repair painful areas. Now, it's easy to tell whether or not somebody is going to be a good candidate for prolotherapy or if they actually do need a knee replacement. So there are times where actually you do need a knee replacement.
Let's talk about prolotherapy, because I think this may be a new concept that people are, not necessarily new, but maybe people are hearing it for the first time here in our area. How do you explain what prolotherapy is?
Well, I like to just explain it simply that prolotherapy is a natural injection therapy. Like, people are familiar with cortisone shots and stuff like that. Prolotherapy is natural, so what we do is just restart the healing process. So if you have an injury or somebody has an injury, they tweak their knee or they have arthritis. Like, arthritis is degeneration, so what an arthritic knee needs or a degenerated knee needs is regeneration. So the injection technique to regenerate a structure is called prolotherapy. So prolotherapy stimulates the body to repair painful areas.
It's using natural things that are coming out of your very own body, right?
Yeah, there's typically two types of solutions we use. One type of solution, like I said, is natural. So we use the natural sugar in the body, which is called D-glucose or dextrose. So that's kind of the normal solution we start with. But we also can strengthen the solution by harnessing your own natural healing structures in your own body. Like, we can take out components of your blood, of your bone marrow from your bones, or your fat, and we can use that as the proliferant. So we call that type of prolotherapy cellular prolotherapy, because we're using your own cells to stimulate the healing cascade, to restart the healing process, to try to eliminate your pain by repairing the structure that's causing the pain, whether the structure is cartilage, meniscus, ligament. We're just trying to get the body to heal again and finally heal that structure so it's strong.
And that's still considered non-surgical, which I think people are looking for a non-surgical option.
No, exactly. Like, we know that knee replacements and hip replacements, some people need it. But for somebody who's looking for an alternative, prolotherapy is a really, really good alternative, because, again, a degenerated joint needs regeneration. So the injection treatment to regenerate a joint is called prolotherapy.
I love that you're honest about that, too. You know what? Sometimes someone may need a knee replacement. I mean, we know that this may not be the answer for everybody, but this is certainly another option for people to consider when, hey, a lot of times they don't want to go into surgery. I think that's a very common wish.
Yeah, if they don't, or they want to delay the surgery. But it's actually easy to tell whether somebody's going to be a prolotherapy candidate or they need surgery. So all you have to do is your bad knee, how much range of motion do you have in your bad knee compared to your good knee? If your range of motion is almost identical, you're going to be a great prolotherapy candidate. But if you can barely move this knee, like you can barely move this knee, and this knee works fine, then you're going to need, a joint replacement. So that's kind of just a gross way to tell.
Okay, very interesting. Well, and I know, again, people are going to be very interested to hear about this. best way to come in, find out more about prolotherapy, certainly check out your website, I know, caringmedical.com, and then you invite people to call you, come in and meet you and have a consultation, see if they are a good candidate.
That's always the best way.
That's the best way?
Yeah.
Thank you so much for letting us be here this morning. We look forward to having you back and seeing what prolotherapy can do for people. It's exciting stuff. Thank you.
Thank you, Carmen.
For more on Caring Medical, all you have to do is head to our website, fox4morningblend.com. It is very interesting. I certainly recommend people to call them and find out more about prolotherapy.
I love that they're right here in our area, too. It's nice to find out where these places are because it's amazing what they can do with the medical advancements these days. It's crazy.
Well, from Caring Medical to confusing medical care coverage.
Up next, we help take the confusion out of signing up for medical insurance this year. Stay with us.